As per level of decomposition, all of them were severely decomposed.
The conflict of interest bill that's currently in Parliament poses a threat to medical professional operations and also how patients access healthcare. This is according to medical experts who opine that the bill, if enacted, will require public officers, including medics employed by the government, to declare or decline any other offers that conflict with the services that they render to the government. Beldin Waliaula looks at the bill and its impact on the medical field.
The raft of radical proposals are contained in this Conflict of Interest Bill 2023 that is likely to cause conflict or experience resistance if enacted. The bill says a public officer is in conflict of interest if the officer exercises an officer power, duty or function to further his private interest or the private interest of another person or his family, relative or associate. Is in a situation where the private interest of the public officer can reasonably be perceived to impair or influence the public officer's ability to act objectively in the performance of an official duty, or has private interest that could conflict the duties of the public officer in future. According to the bill, a public officer is a person who renders government services, whether appointed or elected, full-time or part-time, permanent or temporary, and includes a state officer, employee, consultant, or volunteer. This definition also includes medical professionals. Clause 23(3) of the bill says a public officer shall not engage in any other gainful employment without permission from the reporting authority and the commission, that is EACC.
Just recently, the Cabinet approved the Conflict of Interest Bill 2023, which has been forwarded to the National Assembly for further processing. It is envisaged that if enacted into the law, the legislation will help to curb the challenge of conflict of interests, such as the identified by ESC in the procurement and financial management relating to health projects in the counties and at the national level.
The bill continues to say a public officer shall disclose in writing to the reporting authority any offer of outside employment that could place the officer in a situation of conflict of interest within 7 days of receiving the offer.
We say we don't object to that, but then we just say that the government then must be ready to pay the doctors, the health workers, consummated to the work that they're expected to do.
Davji Atela, the KMPDU Secretary General, adds that for the bill's intention to be fully achieved, the government needs to invest more in the public health sector, adding that implementation of the bill will not improve service delivery in the public sector if the hospitals are operating in deplorable conditions.
So really, to improve healthcare in the country, that's not about it's a matter of that bill. It's a matter of deliberate aspect of the government to invest in healthcare, human resource, infrastructure, and the drug.
How do you say that during healthcare workers' free time, their availability, they're not working in another facility, when they are not available in the government hospital, is going to help the government hospital? That cannot happen. The reason as to why we have poor services in government hospitals is because of lack of equipment and supplies.
The bill further reads that a public officer is required to take reasonable steps to avoid any real, apparent, or potential conflict of interest in connection with the official duty as a public officer.
For healthcare workers, do they mean that I declare that during my free time, I do my locums in a certain hospital? What would be the interest? What about the rights of the employee?
With regard to compliance measures likely to generate heat if the law is enacted, is that every public officer shall submit to the Commission a declaration of income, assets and liabilities of himself, his spouse or spouses, and his dependent children under the age of 18 years. Beldin Waliaula, KTN News.
Now let's change gears and to turn to the international scene. Well, we start with Niger, where French diplomat to the country, Catherine Colonna, has denied claims of her country's military involvement in Niger. This amidst rising tension following the recent coup. Here now is our international news roundup.